Hi, so today I just want to talk to you about retinol, which is vitamin A. It's an amazing ingredient, but there are a few things you need to know about. It should always be used at night time. Shouldn't be applied during the day, and in the morning you have to cleanse your face to wash off any excess products on the skin. You have to wear a good quality SPF to protect your skin because the retinol sensitizes your skin to the UV radiation. You're also not allowed to use retinol if, or shall I say, it's unsafe to use it in pregnancy or breastfeeding. Retinols come in a variety of different forms. Retinol Palmitate being the weakest one, which gets converted to retinol, which is the most common ingredient in cosmeceuticals or medical grade skincare products. And then you have retinoic acid, which is a more potent prescription-based medication, and is what the cells convert retinol to. They convert it to retinoic acid within the cells for it to have its action. But if you apply retinoic acid on the skin, you tend to have a more sort of aggressive action on the skin and get more side effects compared to just using retinol. A lot of the products I sell through my clinic are encapsulated retinol. That means they are held within a matrix that doesn't let the product seep out at the top layer of your skin. It gets delivered to the right level, which is a deeper level where you want to have its action. So, for example, the short-bought retinol or products that says contains retinol wouldn't have the technology that you need to be able to deliver it to the fibroblasts, which is the active skin cells. And the carrier system used in the technology allows the retinol in medical grade products to be delivered at the right level, but also delivered slowly. So when you apply it in the evening, it is delivered throughout the night. The retinol lasts in your skin for about 72 hours, and most people tend to see any sort of side effects come on about 48 to 72 hours. And the common side effects are sort of peeling, dryness, tightness of the skin, especially around the corners of the mouth. The corners of the nose seems to be quite sensitive. For me personally, I tend to get quite a lot of peeling when I use retinol products on my forehead, chin, and in these common areas. I have used retinoic acid as well, and I've had the same sort of response. You can use less products, or you can use it less frequently, but as your skin gets used to the product, using it daily achieves the best results. So how does retinol help your skin? So it has so many different roles and so many different actions, and that's why it's so beneficial. So for someone who hasn't got any skin concerns at all, if you use retinol, it basically gives you a skin rejuvenation treatment. So it keeps the skin cells healthy. It helps them ticking over. It actually increases the rate of skin cell production. So I'm sure you've seen in my previous blogs about where we make new skin cells, they get made around the fourth layer of cells, and then they come up slowly to the top, and then they get shed off. So retinol increases the production. So the more cells you produce, the more this sort of shedding happens, and it speeds up that process. And obviously doing exfoliation with either a chemical product or physically exfoliating the top skin cells, or using an intense exfoliation like a chemical peel helps to get rid of the top skin cells and then increase the skin cell production from deeper within. So by doing that, you basically have an amazing rejuvenation, and it has other roles because the retinol is acting on active skin cells. It improves the circulation in the area, and it improves the skin quality, and it gets rid of any sort of pigmented skin cells you've got lying at the top. And although there are other treatments required to improve pigmentation per se, retinol on its own does have a significant effect. It also stops one of the steps in the melanin production, so it has an effect on reducing pigmentation. So it's widely used in a lot of pigmentation treatment programs to achieve results. Because the effect of the retinol is quite a slow acting process, it can take months for you to see the improvement that retinol makes. So you can't expect to wear it for a week and see significant changes, although the skin is much brighter when you use retinol. So when you have certain conditions or concerns, for example, like when you have lines and wrinkles or a poor texture or a dull looking skin, the retinol, by increasing collagen and elastin and glycosaminoglycans, which are sort of sugar molecules which helps to trap water within the skin, that increases in quantity. So as you generally do that, your skin gets thicker, more plumper. So it gets rid of tiny fine lines and things that you can see on top of the skin, or irregularities get smoothed out. So that's an amazing product for aging concerns. Then the other common reason we use retinol is for acne. So in acne, there's quite a few different processes going on. One is inflammation, one is sebum production, which is a lot of the sebum being produced, and then it gets trapped under the skin. And one of the reasons it gets trapped under the skin is because you form a dead skin plug which sits on top of the sebum and blocks it coming out. And then that ends up with a bit more inflammation, and then that leads to the sort of papules and pimples that you normally see. So retinol works in a few different ways to attack that. So it'll reduce that sebum production, so you produce less sebum. It reduces the, it improves the skin quality and the skin cells, so that you don't make that plug of dead skin on top. By doing those main actions, it reduces acne. And retinol is the product used as an oral form, is the raw Accutane that you get prescribed from a dermatologist if you've got really bad scarring acne. So as a topical, as a cream or a serum, it has a lot of positive effects that you can gain from using it if you suffer with acne, although you wouldn't use it at the same time as using something like raw Accutane. So raw Accutane has its own list of precautions and risks, and a specific amount of counseling is needed before you go on that sort of medication, and then you have to be monitored. And so retinol wouldn't be used at the same time as somebody using raw Accutane, for example. So coming back to retinol, so as I've said, it's very important product in any skincare regime. And normally if somebody came to me with a list of skin concerns and I see a role for retinol and they don't have skin sensitivity or rosacea or any reason why they can't use the retinol, I would always recommend it to be part of their skincare regime. So in my list of best skincare products after sun protection, this comes next on the list. And then if you wanted to improve the efficacy of the retinol, you would want to be using a very good exfoliant, either as a cleanser or some sort of toner to help with that process. So hopefully I've covered some of the benefits of using retinol. Thank you for listening. Hi, I just wanted to recap a little bit about the use of retinol and how to avoid the irritative side effects that you can get at the beginning. So one option is to use a lower percentage of the product, but considering that you're spending similar sort of money for the lower strength versus the medium or the high strength product, which is about £70–80 for a serum, that will last you sort of an average of 12 weeks if you used it every day. You may not want to start with the lower strength because you might not see the benefits that you're expecting for the money that you're paying. So using it gradually and introducing your skin to it would be the best way to go forward. Quite a few of the medical grade retinol products also have some soothing hydrating ingredients combined in it to reduce some of the drawbacks. So that's something that's interesting. If you went to the supermarket or a department store and bought an equally expensive cream that says it contains retinol for anti-aging benefits, for example, you may find that the retinol is not the main component. It's just one of those things added to the product to give you the anti-aging benefit. Whereas if you went for a medical grade retinol, it's got the right percentage of retinol. It's got the right proportion of retinol that tube needs to have to be able to be marketed as a medical grade product. And the other additives do help it work best for your skin, like antioxidants. They're minimum in quantity. So that's the difference. So if you're going to buy a retinol, please make sure that it's a medical grade product and you're not wasting your money on buying other things that just contains a very weak form of retinol or hardly any in it to have a significant effect on your skin. So just to recap, why would you use retinol? Well, why won't you? Other than a few contraindications I've already mentioned, it gives you anti-aging benefit. It gives you a rejuvenated skin. It treats dehydrated, dry skin. It can treat oily, blemish-prone, acne skin. It treats pigmentation. It plumps up the skin so that the fine lines and wrinkles that you start seeing improves. There isn't any other products in the skincare market that has all these qualities in one ingredient. So after sun cream, this would be the product of choice on my list of skincare regime I recommend for everyone. Yes, it is. It can be made even more effective by using an exfoliant or something that helps to get rid of the dry skin or the dead skin on the top of our skin, so that the retinol works better. But even if you didn't do that, the retinol will still do that job. So it's an amazing ingredient and you should consider it in your skincare regime. Thank you for listening. So I just wanted to do a quick demo of how much retinol you need to use. So I've just cleansed my face. So this is one pump and that is sufficient for my whole face. So I just put a few dots and rub that all in, avoiding the eye area because it's just too sensitive. This is 0.5% retinol. And the concentration is too high for the eye area. So that's done. And then the retinol eye gel, what you need is a fingertip amount, which is that. And basically just dab it on under the eye. Very gently, and on the brow bone. That's it. So that's all you need to do.